And this is a comparison of people who got into medical school in 2012. So the most that you can get on the MCAT is 45. 45, so you get up to 15 in each of those three categories. So verbal reasoning, physical sciences, biological sciences, and then the total number. So these are the average MCAT scores of biological sciences majors. So you can see, and these are people who got in, not just the applicants, but people who got in. So you can see those scores, right? Now we have the people who majored in the humanities, the English major, the comparative literature major, the history major. And oh my, look what we see. Compare, okay? Oh, compare. 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 Why do you think that might be? Oh, the physical sciences too. Okay, any idea why we think that happens? Yeah. They absolutely do, and to get to that place, they do a lot of reading, and we encourage all of our pre-health students to read, and read deep, dense text, not just the science text. The same thing with you can see with the GPAs, the science GPA, and the the average GPA, science GPA, is, you can see there's not that much difference, right? And there's not that much difference with the total GPAs. The difference is, you can see there were many, many more applicants from the sciences than from the non-sciences, and that's why most people that we know in medical school were science majors, because most applicants were science majors, but not because they were any better prepared. Okay. So again, academic success is always the first priority. Find the major that you want, okay? Protect your GPA. You have to really protect your GPA. Because the bottom line is you have to meet a certain threshold with those numbers, and we give you some more information about that as well in just a minute. Find and use your campus resources. I bet you, didn't you see all throughout the day-to-day how many resources there are on this campus for students, whether it's for tutoring, for supplemental instruction, for anything and everything that a student might need. It's here, but it's up to you, the student, to take advantage of those resources. And those resources can include also your advisors, faculty and staff advisors. And here's what's interesting, the smart students are the ones who generally are seeking out the help because they want to be even better. But all students should be using these resources. They're here for you. So very quickly, I'm going to go through this just to kind of show you. And there is also, I'll talk just a little bit about MCAT 2015, but just let me tell you that we are working on that and we're preparing students for that new test. So if you have questions about that afterwards, I can explain a little bit more. But for medicine, it's this the year of biology, and the Gen Chem, organic chemistry, physics, all with labs, and physics here requires calculus, as well as 1 year of English. Now I was standing in the back when I heard the speaker before, and I'll talk a little bit more about that AP credit. Now being required very often is biochemistry, and will definitely be required as we start moving into the new MCAT. Genetics can help, as can math or calculus if you haven't taken it. May be specifically required, but isn't usually specifically required. And these, there may be changes to these, so we always encourage students to stay on top of this, but you can see also dentistry, it's about the same, except that there may be a few more that are required or recommended, particularly anatomy and physiology, econ or microbiome. Now, check this out. Look at pharmacy. They have all those general courses, but then you also have anatomy, physiology, biochem, public speaking, English, maybe molecular bio, and maybe econ. PA is not a backup if you don't get into medical school. PA has more requirements than medicine does. You don't take the MCAT, but you have many more requirements, including for most PA programs, 1,000, 2,000, or for one school, even 3,000 hours of paid hands-on employment. A couple of notes about academics in general and about UCR. If you were here for the previous speaker, most health professions don't accept AP credit. Most health professions do not accept AP credit. If they do, they might do it for math, and they might do it for physics. They don't do it for bio, they don't do it for chemistry, and nor for English. So the requirement of 1 year of English for the health profession schools is not met with AP credit, but they don't want you to go back to the beginning and take that course. They want you to just take one step up and take another course. And that's one of the things that we help you with, is in identifying those courses. C minus here at UCR in most places is a passing grade. You can pass with a C minus, but C minus isn't a passing grade in health professions. It's considered not passing. So the other little dilemma here is that if you have a C minus in a course, you cannot repeat it because it's passing. But you have to repeat it because you need it for a health professions program. So again, one of the ways we assist students is finding a course somewhere else. For all health professions except medicine, it can be a community college, but for the pre-meds, we have to find a 4-year school. All health professions required courses need to be taken for a grade. No pass, fail, or notes. So again, get involved. What do you care about? That's what the Dean of UCLA School of Medicine asked that incoming class during their white coat ceremony. What do you care about? And they, as a med school applicant or any other health professions school applicant, you have to be able to talk about what it is you really care about and how you've demonstrated that. Sometimes students will have an application with a beautifully written essay that says, yes, in the future my intention is to work with the underserved of the Inland Empire. Immediately, the admissions committee is going to look to see, well, what have they done up to this point that demonstrates that? And if there's nothing there, then that's very much a negative for that application. Again, the depth and commitment over time. And just being a member of an organization is not enough. You need to be an active participant, a leader. You've heard the students talk about what they're doing in organizations that they've started. But being a leader in an organization that already exists, taking it to the next level is also a very good idea. Leadership. Healthcare professionals are leaders, are community leaders. Service, health-related for sure, but definitely not all health-related. So out there in the trenches, finding out what's going on with what I tell students are your future patient populations. What are the issues that affect healthcare, and what's being done to address those issues. And of course, scholarship, research. Again, those critical thinking skills. And then as soon as I'm not going to say that's not a checklist though, okay? It's just general information. Okay. So these are just some typical student orgs. There are many, many student orgs here at UCR. I think we have 30 to 43 health student orgs. So that's a really good opportunity for students to find what they really like and what they want to do. So remember, you don't need to be a science major. It will make your life easier at UCR. It isn't a race. The average age of first-year medical student is 24, and that age is going up, by the way. The average age of the entrant MBA student is 27. Students are going out. This is becoming sort of the norm now, that students are not applying at the end of their junior year to start medical school or dental school or pharmacy school right after they graduate. They're going out and doing other things. One of our former peer mentors is in the Peace Corps in Nepal. We have students doing Teach for America. We have students doing City Year. We have students doing research, a lot of things. And the whole idea is that they're growing as individuals, and that will help them be even better applicants to a health profession program and a better healthcare provider down the road. And remember, because you meet the requirements for a health profession program, doesn't mean that you're competitive. So if I think, for example, I think it's Western Pharmacy, it's like a 2.5 minimum, but the reality is that students are coming in on average with at least a 3.5. So a competitive applicant chooses a challenging major, does the coursework, and looks for opportunities to learn even more, whether it's research or additional coursework. It's important for you to begin to develop, early on, to develop relationships with faculty, to get to know faculty. You're going to need letters of recommendation when you get ready to apply to any health profession. And most of the health professions want you to have letters from 2 science faculty who've taught you courses. And they need to be able to talk about more than just your performance in their class. participate in meaningful to you extracurricular activities. And again, you have to learn to balance this with the academics, but that's what you have to do when you're in professional school. And you have to master the course content, and you have to have the academic skills to be able to do that. And then grow as a person. Opportunities for you to grow as a person. I can tell you, I know these guys, right? I know these students. I'm really proud of you guys. You just stood up and talked, right? That wasn't always the case, was it? So they've all grown very much that they, because, and it's been over time, that they can stand up and talk in front of groups, that they can go out and start things on their own. That's the kind of personal growth and development that health profession schools are looking for. And this is what HPAC is here for. HPAC is here to help as you prepare some more. So we provide information about all health professions. We're getting a lot of forensic sciences, so a lot of people watching CSI. Okay? Kind of interesting too. Clinical laboratory specialists, all different kinds of health professions. We work with students individually and in small groups. Peer mentors provide a lot of information. Amber and I do the professional advising, especially as the student starts to, when they reach the place that they're ready to apply, we're going to be working closely with them. We're very experienced. And we also have speakers and workshops and events and opportunities for students to learn more about health professions and their own specific health professions. We work closely with those student orgs that they're talking about too. We have email announcements that go out, students know what's going on. And we work with students all the way from the time that student walks in the office, and we don't require that, our institution does not require that. From the time that student walks in, we start working with them. And we'll work with you all the way through until you are ready to go into the health profession program. And what I love about being at UCR is that our students stay in touch with us after they're even in their professional schools. And that's been a lot of fun, just out of the blue to get a text from students. I recently had a text message from students at UCSF. They were at a big gala, and they just sent a picture of themselves all dressed up and said, "We miss you." We have a student resource room. Most of the time it's a good place to study. Sometimes it's just a rowdy mess. They're in there. But we want our students not to be so serious 100% of the time. We want them also to have balance in their lives. And again, the peer mentors, the 34 peer mentors that we have are the backbone of our program. We see, again, about 500 students each quarter, and we have 200, that's the official number, 249 mentees. And those are students who initiate that. They come and ask for a peer mentor. And this is a picture of peer mentors at work. And this is what we do. We celebrate whenever anyone gets an acceptance, and we put a scroll up every time somebody gets into a health profession program and cheer for them. And these are some examples of some recent graduates, not the most recent, but he's now at UCLA, UCSF Dentistry, UCSF Medicine, Western Medicine, UC Davis Medicine, Harvard. We actually have 4 students at Harvard right now. We have 2 students at Johns Hopkins for public health and 2 for advanced practice nursing. We have students at UC Davis in the vet school and at Western in a number of programs. And so this is what we like to see. This is our goal, is to help the students reach this place where they are, where they want to be, and that they're successful. So we're right close to the middle of the campus. And with that, I'm going to see if any of you have questions. Do any of you have questions?